Hi everyone. Hi, Dragana. Welcome today. As before, today's webinar, this is a different one. This is on social and emotional development in children, and in children with developmental delays. Dragana is going to be presenting the webinar and I'm sure as last time we'll get to learn a lot of new things. So yeah, a very warm welcome, Dragana, to you. And I'll hand it over to you.
Yes, hello everyone. Good afternoon, good morning, good evening. I don't know where you're from. It's nice to see you in this batch number. I will start this seminar by sharing my screen with you and start talking about social and emotional development in children with some insights with children with special needs. Sorry. Okay. Okay. So social and emotional development and children with special needs. We will touch this point by saying that positive social and emotional development is important. This development influences a child's self-confidence, empathy, the ability to develop meaningful and lasting friendships and partnerships. And
excuse me, Dragana, for interrupting you. We can see your notes as well. So please check the presentation.
Mm-hmm. Let me check again. Sorry about this. Let's start again because notes should not be seen. Okay, can someone give a feedback now?
We still can see your notes.
Now?
Nothing is visible yet right now.
I don't know what's happening with this one now. I'm so sorry.
It's still the same.
Yeah, now we don't see the notes. Yeah. Oh, now we do. Earlier you weren't.
You should not be saying that. Okay, just
Yeah, just yeah, now we don't.
now you don't. Okay, just give me 1 minute. No problem, we have a solution. I will go with two. What can I do? All right, let's go with slide share. Okay, so let's start. Sorry about this delay, always some troubles with IT, but now we are ready. So I said that we are going to talk about social and emotional development with children with special needs. As I started, we are going to touch this point by saying that positive social and emotional development is important. This development influences child's self-confidence, empathy, the ability to develop meaningful and lasting friendships, partnerships, and a sense of importance and value to those around him. And children's social and emotional development also influences all other areas of development. Parents and other caregivers, whoever is around the child, play the biggest role in social and emotional development because they offer the most consistent relationships for the child, and consistent experiences with family members, teachers, and other adults help children learn about relationships and explore emotions in predictable interactions. So let's see the overview of our webinar. We are going to say what is social emotional development, the development of emotions, emotional regulations, child parents attachment, stages of social emotional development from 0 to 5 years old, the importance of social play, and some points with about children with special needs and the development, what actually we can do and how we can help them develop emotions, right? So what is social emotional development? Social and emotional development means how children start to understand who they are, what they're feeling, and what to expect when interacting with others. That development is being able to form and sustain positive relationships, experience, manage and express emotions, and explore and engage with the environment. Social development is learning the values, skills, and knowledge to effectively relate to others and participate in the world around us. Emotions serve a social purpose. They allow us to have insight into another's internal state. Primary emotions are anger, fear, surprise, disgust, joy, interest, and sadness. And secondary emotions are self-conscious emotions, embarrassed, shame, jealous, pride, and guilt. Next slide is about development. We will move on to development of emotions. Development of emotions from birth. Children are rapidly develop their abilities to experience and express different emotions, as well as their capacity to cope with and manage a variety of feelings from birth. The development of these capabilities occur at the same time as a wide range of high visible skills in mobility, like motor skills, thinking, cognition, communication, language. Yet Emotional development often receives relatively less recognition as a core emerging capacity in the early childhood years. That is why it's not so in the focus when we talk about child development. The foundations of social competence that are developed in the first 5 years are linked to emotional well-being and affect a child's later ability to functionally adapt in school and to form successful relationships throughout life. As a person develops into adulthood, these same social skills are essential for the formation of the lasting friendships and intimate relationships, effective parenting, the ability to hold a job and work well with others, and for becoming, of course, contributing a member of a community. Disregarding this critical aspect of the developmental child can lead parents and policymakers to underestimate the importance of and to ignore the foundation that emotions establish for later growth and development. It is essential that young children and their feelings get the same level of attention as their thinking. Learning to manage emotions is more difficult for some children than learning how to count and read, and maybe in some cases be a warning sign or future maybe psychological problems. The failure to address difficulties in this equally important domain can result in missed opportunities for interventions. But they've been initiated early. If they're initiated early, these interventions can yield tremendous benefits for large numbers of children and for society. So we need to focus on children's emotional and social development. What is emotion? Emotion regulation. We will move on now on that. What is emotion? Can someone tell me what is emotion? What do you think? It's our psychological response to the environment. What is emotional regulation? That is ability to monitor and adjust an emotional response to that environment in order to reach our goal, right? Infants are born with a few strategies for regulating emotions. First, sucking, gaze aversion, crossing legs, arms to midline. And of course, these strategies to self-regulate increase as we mature. We will move on now to our next slide, which is this picture. That means, see what it means. This in the green zone, it says a zone of optimal arousal. When we are in the green zone, we can appropriately react to the environment and give the appropriate responses to the environment. When we are in the hyperarousal, that is most often when children are in tantrums, and in the hyperarousal when they're sad, when they're crying, when we are not motivating. So we are all trying to be in this green zone, and we are trying to learn our children to be in a green zone. If we have a nonverbal child, this can be very helpful, showing a circle or something like this with the green, red and blue color shapes or whatever, and trying to motivate our children to show us in which zone they are feeling. If they are in the moment of tantrum or when they're crying, okay, I'm sad, are you sad? You always have to talk with the child. If you're sad, how do you feel? So they can just point to the blue pattern or whatever you're showing now. All right. Emotion regulation. This is very interesting that we have to point out now. Emotion regulation, caregiver is aware of, and a caregiver or parents are aware of, and they respond in a way that matches the child's emotional state and demonstrates to understand that she understands the child's internal state. And self-referencing. Self-referencing is from the child's side, looking toward to a caregiver to determine how to respond. So they're looking at you and they're expecting your reaction, and according to that outside stimuli, they are going to react emotionally or physically or however. They're trying to find, sorry, they're trying to find the answer according to your reaction. We are all, of course, born with emotions, but not all of those emotions are pre-wired into our brains. Children are born with emotional reactions such as crying, frustration, hunger, and pain, but they learn about other emotions as they grow older, all of us. There is no general consciousness about the emotions that are inbuilt versus those learned from emotional, social, cultural contexts. It is widely accepted, however, that the 8 primary inbuilt emotions are anger, sadness, fear, joy, interest, surprise, disgust, and shame. These are reflected in different variations. For instance, resentment in violence often stemmed from anger, and anxiety is often associated with fear. Secondary emotions are always linked to those 8 primary emotions and reflect our emotional reaction to specific feelings. And these emotions are learned from our experiences. For example, a child who has been punished because of a meltdown might feel anxious the next time they get angry. Other example can be a child who has been ridiculed for expressing fear, might feel shame and can feel embarrassed next time when they get scared. In other words, we react to our kids' emotions, and how we react has an impact on development of their emotional intelligence. That is what we have to remember. Emotional invalidation prevents kids from learning how to manage their emotions. When we teach kids to identify their emotions, we give them framework that helps explain how they feel, which makes it easier for them to deal with those emotions in socially appropriate way. The emotions our children express depend on their age. For example, we have, in this case, I will mention infants and toddlers because we are talking about children from 0 to 5. Infants are essentially guided by emotions pre-wired into their brains. For instance, their cries are actually an attempt to avoid some unpleasant stimuli or to move towards pleasant stimuli. They cry, they want food. They cry, they want someone to touch them. They cry, they want a hug. That's it. Evidence suggests that in the first 6 months, infants are capable of expressing and responding to distress by adopting self-soothing behavior, such as sucking fingers. Other studies have found that toddlers develop self-regulation skills in infancy and are able to approach or avoid situations depending on their emotional impact. How we can help here? We can play some music. Listening to recordings of play songs can maintain this 6 to 9 months old baby in a relatively content or a neutral state, longer than recording or infant directed or adult directed speech. What it means? It means that if a child is upset, if it's crying, it will be more likely that the child will sit down by listening a song than listening mommy's singing or saying, calm down, calm down. So it's better to play a song. It's more effective. It's more effective than speaking. And in toddlers, by the time they turn 1, our babies or infants gain awareness that parents can help them regulate their emotions. That is obvious. As they grow out of the infancy stage, toddlers begin to understand that certain emotions are associated with certain situations. Some studies suggested that fear is the most difficult emotion for toddlers to learn. parents can begin using age-appropriate approaches to talk to kids about emotions and encourage them to name those emotions. And by the time they turn 2, kids are able to adopt strategies to deal with difficult emotions. For instance, they are able to distance themselves from things that they upset them. How we can help in this stage when they're in toddlers age? Situation selection, so we need to choose modification, distraction are the best strategies to help kids deal with the anger and fear in this age. And in other words, helping toddlers avoid distracting situations or distracting them from those situations is one of the most effective emotional regulation strategies. So as they grow older, toddlers can be taught to handle those situations by themselves. They are capable of understanding different emotions and learning different self-regulations methods that can help them deal with different situations. Providing toddlers with an appropriate framework can help them learn how to manage those emotions by themselves. Naming emotions is vital, and it can help toddlers learn that emotions are normal. Everyday opportunities provide different occasions to talk to your child about emotions. You can talk about some other people's emotions or about their emotions. For example, what do you think? He sure looks angry for other girl on the playground. Or why do you think he looks sad? Something like that. But it's very important to name those emotions. And toddlers can learn about managing their emotions by watching us, but we will move forward with that. We will move forward with child-parent attachment. Child-parent attachment is essential in this age. All right, child-parent attachment is essential, as I said. Infants from relationship with people who are stronger and wiser, they see us like that in their environment. They form relationships in order to be protected. Over time, they develop mental representations of those relationships based on experiences. They use those mental representations to make predictions about future interactions, as well as about the world in general. And children use their caregivers and parents as a secure base and safe place from which they can explore further. A baby is upset and letting the world know through a bout of crying, right? That is completely normal. What a baby's caregiver or a parent does next is the key to how she will relate to the world as she grows. Now I will just touch the base now of infant-parent attachment theory, which looks at whether our child feels safe, secure, and protected with a parent. And some form of attachment will happen with a caregiver, just it's a matter of quality, of course. Attachment theory has established 4 types of attachment: secure, avoidant, and ambivalent and disorganized. What it means, secure. Secure is formed when a caregiver responds consistently with care and comfort, and this infant responds with delight when they see their caregiver or a parent. Avoidant is formed when a caregiver often ignores a distressed infant. This child is less likely to seek comfort from their caregiver or parent. Then we have ambivalent, formed when a caregiver responds with comfort in some instances, but also responds with annoyance in others instances. This infant's reactions in this case to their parents are equally inconsistent. So sometimes they will react with delight, sometimes no. And this organized form when a caregiver completely neglect the baby. This child avoids interactions with others, and it's fearful, right? their behavior won't change whether the caregiver is there or not. Why is this secure base is vital? It's integral to a healthy lifestyle. That's why the benefits of secure attachments include autonomy and willingness to explore, successful interactions with peers, less conflicts with parents, less aggressions, less anxiety. I believe that we are mostly, all of us, sometimes in this ambivalent level, on this ambivalent level, when we sometimes respond with comfort, sometimes with annoyance, but we should all be working on being in the secure, on the secure level, at least by when where children are on this, in this stage from 0 to 5 years old. As they get older, they understand more. So we will, as I said, I will move on to the stages of social and emotional development. There is 8 stages. I will just tell you what are the typical milestones at these stages, throughout all of these stages, and what can you do while going through this time. So stage 1, 0 to 3 months old baby, infant. Typical milestones are they explore their own bodies, sucking fingers, looking at their hands. They begin to social smile. They prefer familiar caregivers. They demonstrate pleasure, and the vocal turn taking begins in this stage. What you can do while baby is this small, you can respond promptly and sensitively to their cues, cries, vocalization, or gazes, engage in short, frequent interactions, smile and make over exaggerated facial expressions, talk, read to them, massage and touch your baby, describe emotions to them. For example, we all do that when we see the baby smiling. Oh, are you feeling happy? Oh, you don't like when mommy wipes your nose, or things like that. But we talk with babies very gently. This is the essential part in this stage. Next stage, phase 2, stage 2 is baby 3 to 6 months. Typical milestones during this period, they begin to initiate interactions with smiles and vocalizations. They begin to laugh. They smile spontaneously. They pay attention to their name. They enjoy turn-taking games. What you can do in this stage, just to nurture the development of your baby, you can continue as you were in the first stage, play games, peekaboo, or they love that games. We all know that. They create routines, bedtime, nap time, other routines, sing to your baby, twinkle, twinkle, these finger plays songs, Itsy Bitsy Spider, we all know that. Allow them to play, if it's possible, with other children of varying age. It's always nice to look children playing with a baby. They talk to baby, they provide a lot of stimulus to infants. Let's see what's happening. It's stage number 3, 6 to 9 months old baby. Typical milestones in this stage. They clearly express several emotions: fear, anger, joy. They prefer familiar friends, caregivers, parents. They recognize, they respond to language, gestures. They use gestures and vocalization to communicate, which is becoming more cute in this stage of child development. What you can do, of course, continue what you were doing, respond promptly, sensitively, smile, talk, read to your baby, massage, touch your baby, play games, sing, describe emotional expressions to them, have routines, expose them to other children and extend family, always good. Next one is stage 4, 9 to 12 months, so 1 year. Typical milestones in this phase: understanding themselves as separate from others, becoming more independent, feeding themselves. They perhaps becoming mobile. Some children start walking, assisting getting dressed, cry when they're separated from caregivers. We all know that when we want to drop them off to no school, these nursery centers, or when we are just leaving the house and then we are leaving them with some other people. They show happiness upon reuniting with parents and caregivers, for sure. What you can do, you can offer them opportunities to explore their environment and come back to you when they're scared. You have to behave like a secure base, create separation and reunion routines, and continue as you have been doing with the longer stretches of play as their attention span increases, right? Children are getting older. Stage number 5, 1 to 2 years. At this stage, children demonstrate a wider range of emotions, including some social emotions, empathies, compassion. They recognize themselves in a mirror. They show affection for familiar people. They can play by themselves, imitate adult behavior, and they become assertive. They keep saying no for some things, right? What you can do, respond promptly, sensitively, talk, sing, read with your child, describe emotions and experiences, create routine, and offer opportunity to play with other children. Stage number 6, at this stage, typical milestones, they engage in independent and parallel play. They begin to engage in social play. We'll get there. They begin symbolic play games, such as let's play the house, let's play the doctors. Rapid mood shifts, they are exploring themselves. Increase fearfulness, continue assertiveness, no, as they explore self-identity. At this stage, they form a gender identity. They become more independent in toileting and dressing. They have preferred friends and they understand friendship. What you can do in this stage, you can talk, sing, read with your child, describe emotions to them and experiences, create routines. Of course, opportunity to play with other children, set clear limits and boundaries, offer opportunities to practice new independent skills, options for children to choose. That is essential if, for example, they want to wear blue or red shirt or standing or sitting, whatever it is, then we need to provide them with the options to choose and acknowledge fears. Stage number 7, 3 to 4 years, typical milestones in this stage. They become more independent. We now have child here who speaks and talks and participate in self-care, follows direction. They share and take turns with assistance, greater understanding of self and others. They also increase expression of social emotions, initiate or join play with other children, more elaborate dramatic play, role play. What you can do in this stage, continue as you have been doing, engage dramatic play with child, allow children to explore and be independent, act as secure base, the most vital thing, and provide social stimulation, play dates, preschool. They need to have social interaction with others. Stage number 8, 4 to 5 years, typical milestones. They have some understanding of moral reasoning, things being fair, unfair, good or bad behavior. They compare themselves with others. They develop friendships. They show awareness of others' feelings. They enjoy dramatic play with other children. They demonstrate a wide range of emotions, sometimes over-exaggerating emotions. They pay attention to details in dramatic plays. And what you can do, you can, of course, continue, apologize when you make mistake, explain reasons for rules and behaviors, because they will ask a lot of questions at this stage, and label behaviors are good or bad, not label the child as good or bad. If they do something wrong, don't say, okay, John, you're a bad boy. Okay, John, what you did, it's wrong. It's not good putting food on the floor, for example. Don't say, John, you're not good because you put the food on the floor. So please label behavior, not a child. The importance of social play. I wanted to touch this because social play is a vital moment in child development, and social play happens when children are playing with adults or with other kids. In early childhood, play gets more social and more complex. By about age 4, children begin to engage in sociodramatic play, cooperating to take in roles and creating their own rules. They're very, very creative. For example, let's pretend we are at the grocery store. I'll be a shopper, you'll be a cashier, or I'll be a doctor, you'll be a patient, I'll be a teacher, you'll be a student. We all had that phases. This is a valuable type of play. Besides having fun in this type of play, children will learn different social skills that include communication, cooperation, problem solving, perspective thinking. Yes. Social play helps children succeed in school life. We can support children, of course, and we can support children's social skill development by playing with our kids, modeling the positive social behaviors that we want them to use. Learning the skills that children practice in social play also takes a lot of sensitive our adult support. So why? Young children often, they do not know what is expected in different social situations. They lack experiences and knowledge of appropriate ways to solve conflicts. They're naturally egocentric, so it's hard for them to understand others' intentions and feelings. And we can also teach them social skills using a technique called scaffolding. What's that? Giving just enough time, enough help actually at first, then letting them to take over and do more and more on their own. And I will tell you now why and how to scaffold children's development of social skills. So we have this communication, cooperation, problem solving, and perspective thinking. In the way of communication, how we can help. Different methods of communication will benefit different place situations. We can teach children appropriate ways of getting people's attention. How? We can tell our child, when you want Nico's attention, say Nico gently, or tap him on the shoulder, then wait for him to look at you or to look back. Help children tell each other directly what they want or need. How we will teach them to do that. You can tell Mary, I want to pretend that the baby is sick and the baby needs to go to the doctor. So we can just advise and tell our children to repeat our words and try to model our behavior. Show them how to join in a play group. That is sometimes just question cannot be enough. Socially competent children often watch the children playing, then they find a way to ace into the ongoing play. So you can tell them, look, they're building a road with the blocks. Or you can go and try to put some signs next to the road. So children just spontaneously join the ongoing play. In this cooperation meaning, we can explain what cooperation looks like in different situations. Sharing, we can explain to our child, hold the book so John can see the pages, or roll the ball to Rachel, Rachel can roll the ball to you. Then in this play, we have taking turns. Cooperation also, they need to be patient, and it helps kids negotiate who goes first, and the time, of course, for each turn. And compromising. We give children ideas about how each can get a little or what they want. Yes. And the problem solving, when children play together, there is always some conflict and we cannot run away from that. Helping kids learn to solve problems. We can teach them how actually to negotiate. We need to teach them how to state the problem. Everyone gets to say what's wrong. Brainstorm the solutions. Again, everyone contributes. Choose the solution that everyone agrees on. Implement the solution. Decide the logistic length of the turn. For example, if they fight about whose turn is next, who goes first, or whatever is happening, and evaluate the situation, how it's working. So if you take turn first, then he will take turn first. Everyone will be happy. Simple example. And perspective thinking, as I mentioned here, we can help children understand the perspective of others by pointing out how others feel, saying, again, naming, verbalizing the emotions. Her face is saying, I'm sad, for example, and how your child behavior affects others. You can give an example. When you insist on having your way, friends may not want to play with you next time. Simple example. Then we can point out how other children might see things differently. For example, when their children are playing and the boy is pulling other boy, you can tell your boy, stop, John might not like you pulling him that fast or that strong, or she doesn't like to be talked that way, or lower your voice down, he has a headache or something like that. What is essential here, that with your support and many opportunities for social play, which I found personally extremely valuable and essential, your children will develop social skills they need to get along with others throughout their lives. Yes, and besides that, they will have a lot of fun. That is shortly about the social play. So let's move on to our next slide. I will just make a short, highlight about importance of social play, right? It provides children with opportunity to practice social skills, make sense of cultural norms and values, process experiences, prepare for future responsibilities, practice communication skills, as we said, practice negotiation skill with peers, and socialize with each other, teach each other what is acceptable and what is unacceptable behavior, right? So we will move on to the next slide. Children with special needs, social and emotional. The special needs, of course, any type of developmental delay complicate development of emotion regulation and social skills. This picture shows here domains of development: physical, cognitive, and affective, and in the center is a whole child. The most important thing is to find where to meet our child, our children, where they are. You can think of development as occurring along trajectory instead of as a static set of stages. So none of any child who has any type of developmental delay goes through the same phases and stages of emotional development. As it says here, delays in other areas of development influence social emotional development, cognitive delays, motor delays, sensory processing delays, communication. And I just put a note here about autism spectrum disorder. By definition, as it said here, it's a disorder of social interaction. Although social delays may have roots in sensory processing and motor planning, so this can be another topic. What we need to do is to meet our child where they are. What to do? What can we do with our children? We can use our child diagnosis to understand challenges to learning, and not as a label for limitation, what it means. If we have any type of diagnosis, we should be informing ourselves what it means, what our children in that moment, in that stage, or in any stage can do, not what they cannot do. So we have to work with what we have and try to nurture and try to encourage development to the level they can do it. Sensory processing, that can be another topic. Emotional processing, it's reacting, giving the reaction from our children through sensory inputs, and change the environment always is the best solution, especially if we have children who are sensory sensitive. In order to reach this level, this zone of optimal arousal, the green level, we can turn off lights, we can change the room, we can remove noises, we can turn on the TV or remove toys, give toys, whatever, just to calm our baby down and try to see what's the problem and how they will react in an emotional way, right? Children with special needs, how we can help them and what should we do? As it says here, engage frequently with your child, shorter periods during the first year, growing to 15 to 20 minutes, floor time, playing after first year. Any type of playing and interacting with your child will benefit in this sense. Monitor your own level of emotional arousal during interactions, because we are also human beings and we are reacting. As I mentioned, these levels of reactions, caregivers and parents' reactions, try to be safe, on the safe level, not ambivalent or disorganized. Try to answer your emotional state. Empathize with your child through gesture, vocalization, language, start at their level. So as I mentioned, with baby 2, 3 months, 6 months, talk with them, name the emotions. Are you feeling happy? Or you like when your mommy is touching your back, or you like when your mommy is patting your head, or, oh, you don't like that. Children are responsive. Yes, follow your child's lead. That's next. Make sure that they direct the play. Individuality is our aim, our goal. And you can sometimes feel, as what it says here, but my child is not doing anything. Your child is always doing something. It's just may not seem that obvious to you or purposeful to you, but they're always doing something. And give your child's actions, emotional meaning. Especially children with autism spectrum disorder, we need to talk with them and explain emotions and teach them right emotions. In teaching children with special needs, especially autism spectrum disorders, we teach them first and the most basic, happy, sad, and anger. So that would be it, happy, sad, and anger with them. If you have any questions, you can ask me. I will try to give some answers. Also, Milena is here. She can contribute a little bit. And in Shani, we are here to give you answers. This was just overview of the emotional development. That's it.
Thank you so much, Dragana, for that wonderful presentation. And yeah, and thank you so much for bringing up so many extremely valid points that you did. Yeah, we can have the questions. Okay, we can see. I guess Milena also wants to
Yes, thank you. I would like just to give a general comment about Dragana's presentation and today's topic. I think that is extremely important what she covered today, and to emphasize the importance of collective effort about our children's emotional and social development that requires our collective effort to build also ourselves, so we'll be able to raise our child. Thank you so much. And thank you, Dragana, one more time for the wonderful presentation. I'm looking forward to the next webinar. Thank you.
Thank you, Milena. And yeah, absolutely. I think this topic is actually very, very important. And oftentimes, like you said, Dragana, to begin with, oftentimes the emotions is something that gets a little sidelined, right? And
Yeah.
emotional regulation and the importance of having developing the healthy emotions, right? That comes right from the childhood and right from when the child is actually born, and how we are reacting to the children. So yeah, anyone wants to ask any questions, please feel free right now. Okay, I think I can see some questions over
Yeah, I
here.
think I saw some questions also. If I don't know who wrote that one, but I will just read it. Can you give some strategies for meltdown when it's a meltdown phase? That goes to emotional regulation strategies, which can be or behavior modification strategies that we can talk about next time. But I will just give you a short answer regarding that. We can first give space to a child. We are talking here about children who are 0 to 5 years old. So if we have a toddler who is having extremely high meltdown, throwing himself, flopping on the floor, throwing toys around the house, screaming, yelling, and doesn't want to calm down, just give them space a little bit first, and but make sure they're secure, they cannot hurt themselves. After that, you can start counting down. You can offer them choices with questions, what do you want? And you can, if they say what they want, then you can say, okay, first stop screaming, then you will get there. First stop throwing things around, then you will get your favorite toy. Stop running around, stop making a mess, stop throwing yourself on the floor, you will get an iPad or whatever they're making drama about. I call it like that first, and then strategy works the best, and it's nothing new in upbringing a child. Not only children with special needs, but with neurotypical children also. I was raised like that. First you do your homework, then you can go outside and play, and it works perfectly. At first you will have difficulties, of course, but eventually your child will get used to that, and they will know what will happen if they stop, and they will know what will happen if they don't stop with that behavior. Any suggestions, Milena, on this one?
Yes, thank you. I also wanted to add that parents should not get like nervous or embarrassed, especially if the meltdown or tantrum is happening in public, because all of those episodes, they don't last forever. Every episode has the end. I also saw the questions about nonverbal students, children, and children who are using textbook. The communication goes the same way. You can ask, what do you want? And the child will hand you the picture. So it's always about the communication and recognizing what is happening. So observe, listen to a child, as Dragana said, offer choices, wait for the response, and honor the positive behavior, honor the positive response of your child. That is what I would add.
Thank you.
Okay, so we have another question here about controlling anger in a special teenage girl. So we have another question before this, which says, to regulate, many to regulate. Not sure what this question is about. Neelam, if you can type out. Then we have the other question that we have is strategies to control anger in special teenage girl.
Teenagers are different category. In a teenage stage of development, in that stage, that child, that person is already formed physically. It depends in what intellectual state this girl is and what are the triggers for her anger. So
yeah, absolutely.
I would also suggest to ask what's the issue, why she's behaving like that. She needs to give an answer if she's a verbal or non-verbal girl, and she needs to make choice. We will provide her with choice and she will make a choice. If I stop, I don't know how the episode of anger is looking, but if she stopped with her anger and behaving like that, she can get what she wants. I don't know to who that anger is aimed for, so I cannot say that much.
Yeah, I think one of the important points to say over here is when we talk about anger, like Dragana said, there could be different factors, right? Like how old she is, like her level of understanding and how she is expressing the anger, towards whom she is expressing the anger, when she is expressing anger, how is the situation, appropriate, inappropriate, is it more of is it an extension of kind of throwing tantrums towards something, or I really want something, or I'm not getting what I want, or so the reasons for why the child is throwing tantrums, and every single situation is going to be very, very different, right? So we have to keeping these very specific factors in mind when we talk about strategies. The strategy is actually different based on all of these factors, right? So yeah, that's something very important we need to understand, and how we are helping the child to emotionally regulate themselves and teaching them the necessary coping abilities, whether it's a problem solving approach that we are taking, helping the child to solve a problem, whether it is emotionally we are helping the child to be able to solve a particular problem, right? And how we are helping them to regulate from maybe a heightened state of emotion or a lower state of emotion to get to that paramount optimal level of functioning. So yeah, these skills would actually vary from child to child, depending.
Child to child, yes.
Yeah.
Thank you. Yes, I see a lot of questions regarding the meltdowns and behavior. As you already reached that point that you cannot really control what's happening, children, they know how they use your patience, they use your reactions. If you want to change anything, depends also on how old is the child and how persistent you are, because sometimes as parents we are with a warm heart and we cannot be very strict, and we just keep losing, and that's it. So we have to be strict, especially with this first, and then that will work 100%.
Absolutely. And Dragana, this is something very common. A lot of the times the parents will ask when they're asking about the disciplining, and, the child is throwing tantrums and lying down on the floor and not listening, and they're doing this in different situations for different things. They are basically, a very common thing they'll say is they're being very stubborn, and I say, yes, children, they can be very stubborn, but we have to understand that when we are parenting a child, the consistency of our approach with the child, in consistency in our parenting, being supportive and loving does not mean that we cannot be firm. In fact, it's also another loving way of telling the child that this is not something that is going to be acceptable no matter what you do, right? So I think that's definitely a point that I would like to mention over here, because since we're talking a lot about these about meltdowns and things like this, and how we are towards the child and what reaction we are giving is hugely important to how they are going to, learn, whether it's because a child is from, when they're absolute babies, they're looking at you constantly to see your reaction to, so all of their reactions, that everything that they're learning, their emotional experiences is based on how you are reacting to them, right? So your mindfulness, emotional, mindfulness is going to play a very, very important role. And we have some other questions.
Yes, I can see. Okay, sorry.
No, go ahead, please.
No, are children with autism spectrum disorder able to join normal school, and by what age? And that
yeah.
of course, the autism spectrum disorder, the words itself says that it's a spectrum of versions of autism, right? So we cannot say for sure yes or no. Some of the children, they can join. Some of the children are in the group with other children, especially if they're verbal, if they're aware, if they can give the proper answers, if they're aware. That's it. If not, they are in special classes with a special needs teacher, and in situations like that. So we cannot say for sure. For any developmental delay, we cannot say for sure yes or no. But there is positive examples always.
Dragana, we have another question here, which is saying how to support a non-verbal ASD child initiating interactions with other neurotypical children.
Yes, but that's all about social play. We
Yeah,
have, if the child, it depends how old is the child. If the baby is small, 2 years, 3 years old, if you have to go in the group, talk with your child, prompt your child. At first, maybe your child will not respond and have spontaneous reactions like to other children. But if you lead the hand, if you prompt your child, say Inshani, look at me, then your child eventually will start saying that, Yes, so you have to be initiator in that social interaction at first, hoping for the best. After that, your child will be spontaneous in that. But it takes time, it takes a lot of work and dedication. So everything at the end depends on you.
Yeah, absolutely. And it really depends on also the level of child's ability to communicate. And oftentimes, we don't, we talk a lot about the child, my child is not able to communicate, is talking in one word and this and that. But we have to understand that even a child's level of social responsiveness and emotional abilities and communication, all these they're linked to each other, all these areas, and how we are able to help a child to communicate, not just verbally, but even non-verbally, how we are helping a child to express themselves. Like Dragana was saying, if it's even when it's a little baby, we're smiling at them, we're making sounds, we're doing gestures, we make animal sounds and we play with them, and we play peekaboo games and hide and seek, looking at them. A lot of the development at this age early on is happening through play, right? A lot of the cognitive development is happening through play. Obviously, social emotional development is also happening through play. And so when you're, engaging, how positively you're interacting with the child, how you look at the child, how you're able to respond to the child, all of these small things really play a huge role. But the individual profile of where the child is at is very unique, so we have to see that often where the child is at when we're teaching, like Dragana said earlier, even during a presentation, we're teaching small skills. During play, we are teaching them to share, we are teaching them to take turns, we are teaching them to wait, we are teaching them to be able to how to play along with someone. There's different stages of play. A lot of the times parents will say the child only plays by themselves, is that in their own world, is not really interacting. So how are we getting the child to even engage with us is going to be dependent on their level of interest and what they're interested in. So observing the child and picking up on that, and letting the child take their lead. because we want to be the ones to do this, do that, and play like this.
Over helping sometimes can be very
Yes.
not
Yes.
beneficial. Yeah.
Okay. And we have
also here I see a question. What do you do if your nonverbal child bites when he gets angry? So how do we manage that behavior? That's also behavior modification here. And how, if nonverbal child, we have to know if the child understands what we tell them. If child, how old is the child? We can actually, the powerful weapon for this situation are the social stories, which I use very often in regulating any kind of unpleasant, unwanted behavior in your child. So try to find a social story, read the social story throughout the day a couple of times, and eventually they will be aware that that behavior is not acceptable. Yeah. And also, if they bite, you have to make a punishment, reward and punishment. That's also a powerful weapon for us. Rewarding, positive reinforcements and negative reinforcements. We have to stick to that.
Yes, I would just like to add, thank you, Dragana, for mentioning punishment. Punishment doesn't need to be, and it is not something negative. Punishment is removing a favorite toy, turning off the video, ending the favorite activity. So just to make clear what punishment is in managing behavior. Thank you.
Yes.
Yeah, very important distinction between reinforcement and punishment. And yeah, it's not always, it depends on how we are helping the child to be able to distinguish between the importance of, this is something that I just cannot do, I will not, and obviously depending on how how stubborn the child is being. And yeah, but the most important and crucial factor over here is always that we have to act in a way that is absolutely consistent, and to help the child realize that this is something that is not going to be acceptable no matter what, right? Because only then the child will stop engaging in that behavior that the child is not supposed to, or obviously we want to encourage the positive behaviors that the child already is showing. We want to encourage and motivate the child for the behaviors that the child is improving on. Good job on doing XYZ. That's equally important as much as we're doing that. But yes, fundamentally no disciplining is going to work out in the long run until and unless it's like the child, it sets in the child's brain that, okay, this, no matter what I do, this behavior is just not going to be acceptable. And there's some behaviors which are acceptable, and there's some behaviors where, okay, we can have a compromise situation, right? Because teaching the child negotiation skills is also is an important part of the social emotional development.
Great, good points.
Okay, let me see. We have some of them which are, I think, repeating. So I'm trying not to.
Going through it.
Yeah. And some of the questions which I want to acknowledge, but at the same time, when we say how to engage a child with a sibling, and that well, again, we need to know the level of the child's cognitive abilities and how old the child is, and all of those factors. All of that is going to determine how we are engaging the child with the siblings, and also their relationship with the sibling, right? Like,
yes,
when we talk about,
we need to teach the sibling what is happening and why is the sibling like this or like that. So we need to work with them also. So it's not only the child with special needs or any type of delay. It's other sibling also. We need to, as we have to talk with families and family members, siblings, and schools and teachers, we have to educate outside world, not only us, right?
yeah, absolutely. A lot of the times they'll say that, okay, my child, they just hit, and the sibling is not playing because he's been hitting the sibling. But exactly, it's equally important for the sibling to understand that, okay, He's not hitting you on purpose, just doesn't know how to communicate his need to play with you, or, what is happening, paying close attention to what exactly, the child. So even socializing, non-verbally when the child is doing something, that's also an expression, that's a way for the child to, be able to get what they're wanting, or they're wanting to play, but then they don't know how to play, right? So teaching the child those skills as much as educating the other siblings as well.
Do you think there is an overall delay in toddlers starting to speak these days? Do you think this is due to the increased exposure to electronic gadgets and screens rather than with people or other children? So what do we think? Is it because of child looking at watching a lot of whatever content, or with interacting with other people starting to speak these days? But I always vote for interacting with other people, no matter how useful our videos, any type of videos are. It's just what's happening with the social life, what's happening with the social part of development, which we kept saying during the seminar, that it's a social play is the essential part of the development phases. So
yeah. And active involvement, right? Active
yes.
engagement, because whatever is happening on the screen, we have to understand it's passive. What happens is it might be like super engaging, but the child's brain is almost, going into like a very zombie state of mind, where the child is just looking at things, is very, very drawn into the world and everything, but still the learning is not happening actively. But wherever, when the child is, feeling things, touching things, is able to, make their own mistakes, is able to, that's how the child exploring the environment is able to, learn how to engage, look at the other person, try to understand what emotions is the other person trying to, communicate, by looking at the facial expressions, and how should I react to this. All of this is happening in a social environment through the practical experiences. When we are taking out all of these factors, how are we expecting that those changes to happen, right?
I'm not saying that the screen time, we cannot completely cut electronics now these days. It's time, what it is. We are surrounded by the IT around us, at school, at home, with more improving technology every day around us. But if you want your child to have a screen time, just set the time during the day. Set the time, half an hour, you have your iPad, you watch whatever you like, and then after that half an hour, we are playing. Sometimes it's hard for parents if you're working, if you have other things around the house, if you have other children, if you're a single parent, it's hard to set the time and play with your child, but try to do that and set the time for screen. You cannot cut it completely, and don't do that. Just first, if your child is having a lot of time in front of the screens, try to cut slowly by slowly, not immediately, because that you will just make a bomb. Just cut slowly, slowly, and eventually you will cut to your desired time, and your child will not spend a lot of time in front of screen, which it's not good. Definitely.
Yeah, absolutely. And I see a question here about emotionally, if the child is not emotionally ready. See, we have to understand that the child's emotional responsiveness, or the child's emotional, when we say, what do we mean by being emotionally ready towards something, right? Is the child not accepting something that you want the child to accept? A lot of the times, is the child, is it to do with particularly the disciplining aspect, which means that the child just will not listen? Or is it about the fact that to do with the parent child bonding, like, understand, we talked about the secure attachment development, and how your bonding is with the child, and with the parent-child bonding, and also the bonding with siblings. All of that is going to determine how the child is also responding to you. That we cannot just take that out of the equation, and say, okay, the child is not, it's child is not functioning in isolation. So we have to understand, okay, how are we contributing to the child's responsiveness? How do we need to maybe parent differently? Is the mother, father, different members of the family, are they on the same page or not when it comes to the emotional responsiveness of the child? And trust me, these factors are going to play a huge role in how the child is learning to not just emotionally regulate but cope with different situations. It's the child's personality is forming, the child's tendencies are developing in terms of how they learn to associate with another human being, how they learn to associate with other children, how they learn to view the world. Their worldview is developing. So a lot of the things are actually happening because of how we are responding, especially the primary caregivers, how we are
And
responding.
especially in this phase of development from 0 to 5 years old, this is something that we have to be very careful, because whatever we learn our child up to 3, 4, 5 years old, that's for the rest of their life.
Yeah. Okay, let's see any other questions that we haven't taken till now.
Maybe we can make another one just with a behavior modification, because this is what parents are most concerned about.
Yeah, that definitely seems to be the case. That would have to be a separate separate talk in itself.
Yeah. But what is the most essential note or highlight of our conversation today is we are the main actors in this process of child's emotional development. So we are the one who are determine their development. So we have to be patient, we have to be responsive, we have to be caring, we have to be loving, we have to be patient, as I already said. But we are the main actors. So especially with children with special needs, that responsibility doubles.
Yeah. There's another question, I think, it's talking about laughing at serious things, how to teach appropriate expression in situations for non-verbal 9-year-old autistic child.
Sorry, can you repeat again? Laughing at serious things, how to teach proper expression in situations for non-verbal 9-year-old autistic child. As I said, like social stories works the best. We can make a story, for example, while I'm sitting in the living room, I can see my sister is doing something very important, reading, and she is worried, she is concerned, and while they're doing that, I'm laughing, but my mom thinks that it's not good. I should not be laughing when something is serious. It depends on the level of understanding of the child, and the story can be very simple, but also very effective. So social stories work. We should be using that more often, especially in the home settings, yes.
Yeah, I'll just quickly add social stories and also behavioral modeling, because if the child is, laughing inappropriately and we laugh at that or something, how we are responding to that. And we are also, putting that in the child that, no, you're not supposed to laugh. So, again, our reaction to that and how we're modeling that behavior. Yes. Biting when the child gets angry, a lot of it is behavior related. Yeah. Again, that's an inappropriate way of the child, in how the child is expressing the anger, obviously, but it could also be, there could be a sensory reason for why the child is doing that. There could be a lot of, different reasons why the child is biting in the first place non-verbally, out of frustration, out of anger. The child obviously, and again, depending on what is the cognitive level of the child. Dragana, do you want to add anything to that?
Nothing. I think I already mentioned that with the anger and the biting, social stories, and as Milena said, with the punishment and rewards and positive reinforcements. I think that we already covered that. Yeah.
Yeah. Okay. Great. So I think we have covered most of the questions. My boy is 5 years old. Nowadays, he's showing his emotions through gestures, smile, and making faces. He doesn't want to sit for study. He hates books.
Okay, you need to first work on sitting, practice sitting, and then introducing with some materials on the table while he's sitting, and then
Yeah,
step by step
that's
with books. Yeah.
That's more to do with the behavior rather than the
Yeah.
emotion, to be
Practice,
honest.
practice
Yeah.
sitting first. You sit for 2 minutes and then you can go run away. You can go do whatever you want, and then increase the time of sitting. After 2-3 tries, try to introduce him with something that he likes and that will keep his attention, and he will continue sitting. Right after that, slowly, step by step, put one book, and so on and so on. We already talked about timing and increasing time, training, sitting, and so on.
Yeah. Yeah. Again, there's another question of anger and aggression, doesn't want to write. And see, these questions, if the child is not wanting to do a specific thing, that means the issue is with that particular thing, right? And that the child is not wanting to maybe write or sit. That's more to do with that particular thing and how we need to work on that rather than the emotion per se. Of course, there would be a lot of things you have to understand that the children would not want to do, that they will express their anger towards them. And so obviously, if the child has picked up from somewhere, right, that okay, I'm going to be angry and going to be aggressive, and so this so that I don't have to write,
Yes, this
but
situation happens with the neurotypical children also. Yes.
Absolutely. Yeah. So staying calm when the child is high, you go low, you stay calm, you tell them that no, you're not, you're not supposed to be doing this. You're not supposed to show anger. You can't be asking the child to not be angry and be angry yourself.
Yes. And stick to that.
Yeah.
Yes. Don't let them play you.
Absolutely. That golden words.
Yeah.
We are playing something, he shows interest, but not for study. Again, it's more to do
If
with
he doesn't want to study from the book, you can make a poster, you can make a whiteboard, you can take a tablet, but using it for studying or something else. It doesn't have to be a book. I don't know what type of books you have, but you can try to show the materials that he has to study through something else.
Yeah, absolutely. So great. I think we're done with, we've covered mostly all the questions, and we have to understand that the emotional aspect of things is related to specific situations as well, right? So a lot of those questions we have to look at the overall context of that. But thank you so much, Dragana. Again, thank you so much today for the wonderful presentation. And any last words of wisdom would like to share?
Words of wisdom. Pay attention on your child's emotions, because as mentioned before at the beginning, we often put that on the side. We are more worried about sitting, writing, talking, listening, whatever. Child's emotions shape their personality. So yes.
Absolutely perfect. That's absolutely perfect. I would, the first thing, Dragana, when you started with the presentation, that's exactly what was going on in my head. That's like, if only we understood a little bit more about how extremely important the emotions are, and how crucial role they play in how we socialize and how we even communicate, right? Yeah, because communication is the most common one. And the
Yes.
first thing that parents would talk about is the communication, is not able to communicate, is not able to say these many words, this sentence and that. But the emotion is also a huge part of how the child is, communicating also in a way, and understanding the world, and socially, developing their own personality, and who they are going to become is going to be dependent on that. So yeah, thank you so much. And yeah, thank you everyone for participating today. And if you have any other questions, please feel free to reach out to us and email us, and we'll take up the queries. Yeah, thank you so much everyone.
Thank you, Shani. Thank you, Milena, for joining. Thank you, everyone. Sorry for the little delay at the beginning, but everything turned out well. Thank you.
Thank you.